All right, in this video, we're going to do our overview of some key terms and concepts that we want to have a good understanding of before we move into our assessment. So what we're going to do is use this spine as a little demo. We'll use this spine and myself to kind of go through some of these terms and concepts. So first, lumbar spine. So that's this blue section of spine here. It's our lower back. So when we think of lumbar spine, lower back, we'll be using those synonymously throughout. Next is the thoracic spine, this darker green portion, this bigger portion that makes up our mid-back. So thoracic spine, mid-back, we'll use those synonymously as well. And next is our cervical spine, this upper portion here, this green portion. So that's our neck, so neck, cervical spine, C-spine. We're going to use those terms synonymously as well. Next is our pelvis. So that's these two big bones here that make up part of our hip joint. So on either side we have the pelvis that's connected here. The pelvis is ultimately connected to the lumbar spine, and that's going to be an important concept that we get to in a minute. So the pelvis makes up a joint, our hip joint, with the femur. So that's our thigh bone that kind of sits right in here to this cup, which we call the acetabulum. So we have our hip joint here. So when we get motion at the hip, it's motion at this joint. So it would be the femur kind of going back and forth between flexion and extension. And then when we have lumbar motion, the lumbar spine is allowed to move through flexion and extension. To make things as simple as possible, we're going to refer to the lumbar spine, low back, flexion, extension as well. So that leads us to our concept of pelvic tilt. So we're going to have anterior pelvic tilt and posterior pelvic tilt. So we'll start with anterior pelvic tilt. So anterior pelvic tilt is going to be the pelvis moving forward. So in an anterior pelvic tilt, we have our pelvis moving forward. We're getting synonymous terms here, coupled motions, however we want to refer to it. So anterior pelvic tilt is going to be synonymous with hip flexion and lumbar extension. So you can see as I move through the anterior pelvic tilt, the hip is in a flexed position, which subsequently moves the lumbar spine or the low back into an extended position. So if I were to demonstrate that and I move into an anterior pelvic tilt, so if I get hip flexion and lumbar extension, so this is the anterior pelvic tilt. So belly kind of comes out, get an arch in the lower back. So we'll be referring to an arch in the lower back a lot as we go through our assessment, and that's going to be synonymous with anterior pelvic tilt. So next is going to be posterior pelvic tilt. So it's going to be the opposite motion. So it's if the pelvis is allowed to move this way in a posterior direction. So this is going to be synonymous with hip extension and lumbar flexion or low back flexion. So we get those two motions as a result of the posterior pelvic tilt. So a lot of times I'll refer to these motions, the hip flexion and lumbar extension. So I'll refer to hip flexors and lumbar extensors. So that's kind of our anterior pelvic tilt. That's how we know we're talking about that concept. And in posterior pelvic tilt, I'll often say abs and glutes, because that's going to be our main muscles that couple for that posterior pelvic tilt. So our hip extension and our lumbar flexion. Now, whenever I refer to glutes doing hip extension, they're not the only muscles that do hip extension. That's just the way I'm referring it to make it as simple as possible. We also have some work done by the hamstrings and the adductors, but we're just trying to keep things as simple as possible for our demonstration. So we have anterior pelvic tilt, which is this way, posterior pelvic tilt this way. We're kind of getting into more flexed position in the lower back. So now we want to take a look at some muscle implications and understand why this concept of pelvic tilt is going to be so important as we go through our assessment and we're assessing the movements in the squat, the deadlift, the overhead, right? So we want to think of two muscles. These are going to be our two most important muscles, the rectus abdominis, so that's the six-pack muscle that we typically associate with doing crunches, and the psoas major, that's going to be one of our hip flexor muscles. So to understand why these muscles are so important, we want to understand where they're coming from, so what their origin is and where they're inserting into, where they're going into to take on their function and how they kind of fire, right? So let's start with the rectus abdominis, the six-pack muscle. To make things as simple as possible, we have our six-pack muscle that kind of starts up here right at the ribs, so right around this area right here, and it's going to insert right here on the pelvis, so kind of right in the front. So the abs, if this end is stable, it's going to be allowed to flex the thoracic spine, right? So that's our kind of our crunching motion that we associate with the rectus abdominis, the six-pack. But, so let's think about this. If we can stabilize this upper portion, right? What it's going to allow us to do is the abs are now going to pull this way. So they're going to pull into a posterior pelvic tilt. So the abs can get hip extension by doing a posterior pelvic tilt when they're allowed to pull on the pelvis if we are stabilizing this upper portion here up at the ribs. So what that means is a lot of times you're going to hear me cue ribs down, deep breath, stabilize the ribs so we can then stabilize the pelvis. So when we use any of those cues, what we're trying to do is get the abs to do a posterior pelvic tilt. So to understand why we want the abs to do a posterior pelvic tilt, we want to know what the Psoas Major, or one of the hip flexor muscles, is doing. So the Psoas Major, one of the hip flexor muscles, there's other hip flexor muscles, but we're going to focus on this one. It actually takes its origin from up here in the lumbar spine, and it inserts onto the femur, so down here. So it's allowed to do motion in the lower back, the lumbar spine, or at the hip, right? So it can do hip flexion. It's involved in hip external rotation as well, but we're going to just focus on flexion. So if that muscle is allowed to just kind of do its function on both ends, not stabilized, what we get is an anterior pelvic tilt, because it's allowed to pull on the lumbar spine, it's allowed to pull these vertebrae forward, and it's allowed to pull the hip into flexion. So we consequently get an anterior pelvic tilt if we're allowed to use this muscle without stabilizing the pelvis. So we don't want to get this, because then we're kind of increasing some of the stress in these joints back here in the lower back, in the lumbar spine, lower back. I'm already starting to mix up the words and intertwine them, and that's okay, because we are going to refer to them synonymously. But we have that happen, and now we no longer have a good position to go and do our exercises at our squat and our deadlift. We never want to be pulling or squatting with a super arched back. And then there's other implications we can get into with intra-abdominal pressure and other things like that. But we're just focusing on maintaining a neutral position of the spine when we're doing our exercises like the squat and the deadlift and the overhead press. So if the Psoas Major, if the Psoas muscle, the hip flexor muscle, is allowed to pull us into that anterior pelvic tilt, we need a muscle that does posterior pelvic tilt to help stabilize the spine so we can just get our motion at the hip that we're looking for. So I can tell you it's not going to be the glutes, because we're not going to try to use the hip flexor and hip extensor muscles down here. So that's where the rectus abdominis, that six-pack muscle that comes in, pulls up on the pelvis and does that posterior pelvic tilt, comes in. So a lot of the exercises we're going to do, I'm going to cue ribs down, abs down, deep breath, tighten the abs. The reason we're going to be doing that is so we can stabilize up here, so our abs are stable up here, so they're allowed to pull into a posterior pelvic tilt, so that the hip flexor muscles can work and fire for their hip flexion and not move the lumbar spine. So we're using the abdominals in this situation to essentially disassociate the movement at the hips and at the lower back. And that's going to be a really important concept when we get into our squatting and our deadlifting. So that's going to be our overview of our key terms and our pelvic tilt and kind of how some of our muscles work here. So without any further ado, let's get started in our assessments.